there are a lot of things that are coming into play, and the shifts of care that pharmacists are providing. There's some narrowing of networks that are done by some health plans, which can be very alarming for community pharmacies. One way to make sure that you are very well positioned to stay inside a network or to participate in these emerging pay-for-performance programs that many Medicare Advantage and other health plans and PBMs are offering at this time is to ensure that that value proposition related to quality is just natively part of the culture for your pharmacy. Not just at the corporate level and have that trickle down, but for the community pharmacist, who the PIC and the staff pharmacists, to just have that be front and center in what they're thinking about when they're delivering care and creating the culture inside of their own practice setting. So the changing dynamics, I think, are influencing the way that we provide care. I mentioned previously this rising CMR completion rate measure. That's going to put more pressure from health plans to have their community pharmacists providing that service at the point of care for patients. Now, the other dynamics that are coming into play are, I mentioned the pay-for-performance programs that are already existent in the marketplace. Well, if I know that, for example, my patient, Mrs. Jones, the 67-year-old diabetic, is receiving her diabetes medications from my pharmacy with a low adherence score, and I also know that I haven't done a CMR for her, and I need to get my CMR completion rate up. One, I'm going to provide that CMR completion rate to help meet those quality goals. Two, I'm going to make sure that that CMR includes some information around taking her medication appropriately, given that I know that her performance scores thus far on her adherence-related quality metrics aren't quite where they need to be. So getting patients to have a good medication adherence rate and completing them CMR and tying those to incentives, that's a great way to be able to make sure that pharmacy is able to provide those ancillary services outside of dispensing that are of such high quality, that fit into our training and our desires, and that really meet the needs, the quality healthcare needs of the patients that we're serving.